The doctor wants that his patient should be alive as long as possible. And in that pursuit, we suggest treatment. And that many a times has problems. So first, in my understanding, we also teach our doctors, fellows, you have to understand that patient is most likely a terminal type cancer. Not many treatments are going to help her. Treatment will be difficult and they may cause side effects and they may actually reduce the quality of life and the duration of life. The caregivers they are very emotionally attached to the patient and they want that yes, giving cure is the only job, but many a times they forget that in this giving cure business the patient actually suffers a lot. So all the three people should be on the same page and they should understand that yes, this is terminal and whatever could be given to keep the patient comfortable and support him most likely at his or her home level is probably the best treatment. And we have many examples where the patient actually lived much longer even though not much treatment was offered. So that I would suggest. Terminal stage patient cannot become a curative patient by 1 or 2 test reports. Many patients, even though they look older or they appear sicker, sometimes giving something really makes them comfortable. So on one hand, when the disease itself causes trouble, and that trouble is because of the disease itself, trying to control the disease will give them control. In certain situations, the disease is not that disturbing, but the patient is psychologically more disturbed as compared to the disease which is disturbing. In that situation, probably treating the disease is not a good idea. You have to give comfort to the patient either by talking to him directly or through relatives or through counseling or through various other visual aids which are available easily on the system. A positive attitude in life really makes a difference. It has been shown in science as well that if you are happy, you heal early. So you have to be happy and patients accept the fact. Many a times we feel that the patient will not accept, but it's the reverse. Many a time the patients accept and the caregivers are not accepting. So we have to struggle with the caregivers more than the patient. And ultimately, I think the patient's wish is most important. What I feel is that a smiling doctor in the OPD itself does the magic. The people who in the hospital, be the customer care, be any other person, housekeeping, everybody should be smiling and cheerful. The caregivers also should be smiling and cheerful. We should not let the patient think that the patient is a patient. We should treat him as any other ordinary person. Nagging him all the time makes his life more difficult. So if you treat him as a normal individual, the patients really cope with the disease very well. In last 15 years, I have hardly seen a patient who has easily not accepted the fact, be of any age. A child also easily accept the fact. There are children who used to tell us that I am not going to live, but I am not going to die so easily and not in pain at all. So children also are very sensitive and they understand the fact easily. So this is a combined effort, not one person's effort at all. Such effort should definitely be done, not as only as a feature film, that many feature films are there, but this should be as a part of national program. The government should take initiative. It must have taken many initiatives and this should be imbibed in everybody's mind. Probably you may have to start lesson in the school or in the college that yes, this is an important part of life and many of us eventually may have to deal with this. Not now many patients are dealing. Some of us also may be in the similar situation few years from now. So more or less it should be a sort of curriculum that how to deal with patients, how to deal with individuals, how to take care of pain. All this is very necessary and this film will definitely improve the patient's understanding and knowledge.